Male infertility is more common than many of us think, affecting 1 in 20 adult men in Australia. Fertility professionals and men struggling with fertility want to raise awareness and understanding of the challenges and causes of the issue. Professor of Reproductive Medicine at the University of Western Australia, Roger Hart, joins us now from Perth. Good afternoon and welcome to you. Can I start by asking, why don't we hear as often about the challenges facing men in terms of their fertility as we hear about the challenges facing women?
I just believe it's not got the profile. We don't acknowledge it is commonly. Obviously, it's women that get pregnant, and so it seems to be the perception that it's a women's problem. But it's not. It's usually a dual decision to try to conceive, and it's a dual journey that a couple go on in trying to conceive. But it's roughly a third of infertility is male related, and commonly there may be some factors in both the man and the woman which may limit the ability to conceive. So it's a common problem, and it's not got the recognition that it needs.
And so, because it isn't discussed as often and as openly, does it often strike affected men as a bit of a surprise when they experience difficulties starting a family?
Well, it's I do think that men are much more distressed about the concern when they present with infertility. It really feels it's a striking at their manhood. It's really women are generally much more accepting of these things, whereas men can often take it as a sort of striking at their manhood. So it can be emotionally challenging for men to find out that, because generally they don't find out. It's when the tests are done, sometimes by the general practitioner, sometimes by the fertility specialist, that it actually transpires that is the issue. Yes, and I'm sure for many men it's a real shock, and it can be a devastating finding, really.
While preparing for this interview, I read that there has been a significant drop in sperm counts in recent decades. Why is that, and is there anything that men can do to look after their fertility and to preserve it?
Great question. So this is a much debated topic. So it is believed that there has been a bit of decline, but perhaps that may have stabilized, so perhaps the last decade or so. But certainly there does appear that there has been a decline in sperm counts. And certainly work that we've done in the RAIN cohort in Western Australia, where we looked at a representative sample of West Australian men at 21 years of age. And we found that 1 in 5 men, their sperm counts didn't meet the WHO standard for what's considered the lower limit of acceptability, which is quite staggering and really quite alarming. So what can men do to try to maintain the sperm count and try to improve their fertility? Well, it's a similar message we say, well, no matter what specialist you're talking to, is try to look after your health. The testicles are a real barometer of a man's health. And so obviously that's not all scenarios. There are other genetic causes, for instance, but generally a man who looks after his health is a healthy individual will generally have better sperm quality than a man who is unhealthy. So simple lifestyle messages, Kirsten: weight loss, healthy diet, minimal alcohol, taking a multivitamin. These will improve semen parameters, absolutely.
And when we're talking about lower sperm counts, are there implications for any children conceived?
It's a good question. We do know that children born from IVF do potentially have a predisposition to a slightly higher rate of congenital malformations. So effectively, the more invasive the treatment that we offer, potentially the risk to the child could be marginally increased. These risks are very, very low. It's just the fact that we do so many cycles across the world each year, we can see these marginal influences. So, so trying to conceive naturally is by far the better for all concerned. It's better for the man's emotional feeling, certainly for the woman to save her going through fertility treatment. And certainly it appears therefore for the child. So to try to avoid having to do invasive fertility treatment is obviously it's obviously a good thing to do. So lifestyle measures, potentially some medication for the man, perhaps some as a field that we perhaps don't give it the due deference that we should give to male infertility in terms of investigation and treatment. So society, we need to embrace the fact that males are very important in this dialogue, and men need to address their health, the sperm counts, but also as a specialty, we need to give more acknowledgement to male factor infertility. I agree.
Just one final question. When a couple present and may discuss concerns about possible fertility issues, how is that usually investigated? Is it usually the woman's health that is looked at first? And should it be the woman, or should it perhaps be the man? Probably a little less invasive to actually follow up the man's fertility first.
Yeah, absolutely. It's we've got to investigate as generally they're a couple, as a couple. Sometimes the GP is a little bit confronted about discussing sperm counts because there are a few factors, lots of variables there. But certainly they should be, when they see their fertility doctor, that they should obviously have perhaps some blood tests as well as a sperm sample and potentially an examination if that's warranted. So certainly these should be done hand in hand rather than it being seen as a woman's problem and just the woman investigated. It's not a problem, it's a dual concern, and the vast majority of couples can achieve their desire of a child when they're treated in expert hands. So they need to be investigated together, and it's not about apportion blaming. It's basically, what is the issue that's limiting their ability to conceive? Let's investigate thoroughly and appropriately treat. But shouldn't be just seen as women's business. This is a dual concern.
Thank you very much for your time this afternoon in discussing this with us. Professor of Reproductive Medicine at the University of Western Australia, Roger Hart.
Thank you very much, Kirsten.